Welcome to the Triple D Podcast, Donuts, Disability, and Discourse, where host Michael Leiner talks to the best in the business about community, impact, business, and donuts. Here's your host, Michael Leiner.
Welcome to another
Thank you.
episode of the Triple D Podcast, Disability, Donuts, and Discourse. I have an exciting guest this week, Dr. Stephanie Pope, who is a child psychiatrist here in Northeast Ohio in the Cleveland area. Where's your... Now, you just dropped some news on me a few weeks ago that's exciting in your life. You opened your own practice, your own clinic.
Yeah.
Tell me about that.
Yeah, so it's based in the Chagrin Falls area.
Which is almost like where we are, right? So we're here at the Mad Batter.
Yep.
I think we're technically in Bainbridge.
Yes, I think that's right.
Yeah.
And then so down East Washington is the office that I'm practicing under. The name is Greater Cleveland Psychiatry, and then that in-person
Very
office.
appropriate name
Is it?
for a psychiatry office.
Yes, yeah, and then there's virtual visits through Zoom, of course, which people are more familiar with, but sometimes I prefer the in-person appointments here on East Washington.
So you prefer in-person.
I think so, yeah.
Which is interesting because when you said that, you're offering virtual appointments, has that changed how you're able to practice medicine at all? Where, before there were geographic boundaries to where people would seek help. Mm-hmm. But now with the availability of a virtual option, are you able to expand how far you're able to help people?
Yes.
How does it work with doctors? Could you help somebody in another state?
Where you're licensed.
Okay.
So if you're licensed in Ohio, you can see a patient who lives in or based, and they have to physically be within that state.
Yeah.
So it certainly opens things up. I have some patients that live probably 2-hour drive from where I am.
Right.
Now there's some rules and regulations about the frequency of those in-person visits and that type of thing, and so they have to get in the car and make a day of it. There's also some other advantages too, like if a patient is at college, instead of say, hey, you need to take off and come back to Cleveland, we can have the appointment there, or if they're having a crisis or a subacute crisis, you can have an appointment with them in their dorm room instead of, say, having to wait for when they can come back. And a lot of college kids don't have cars. So there's some positives there, too.
What are the rules like? You said that there's only a certain amount that you're able to see somebody virtually. So how often does somebody need to, come into your office here?
It depends.
In a normative situation.
It depends on the medication.
Okay.
But then also there's an umbrella of, you still have to practice good medicine.
Sure.
So you could always say we need to have in-person appointments, say to check vitals or to have a different level of therapeutic discussion.
Yeah. What made you decide that you wanted to go into psychiatry?
Oh, a lot.
Oh.
I really love my job, but I did not go to medical school thinking I'd do psychiatry. I thought I'd be a doctor for a long time, for many reasons.
Were you Halloween's coming up at the end of the month? Were you always dressed as Dr. Pope?
No. It was sometime around 4th grade. I was like, oh, this is amazing. You can use your brain to help people get better. And, at the end of the day, people really care about your health. And I really had all these ideas, having this great clinic to, help the community service. And so I was really in love with it. But I thought I would deliver babies. I thought I'd be OBGYN.
Really?
Yes. That's what I was so dead set on. And then my first year of medical school, I did an elective where I was delivering babies. And for another long story, I delivered some babies by myself as a first-year medical student. Yeah. And so, which shouldn't have happened, but that's what happened that day. And I was like, I do not like this. This is not what I want to do. This is great and amazing, but this is not kind of my style. And so then I thought, gosh, what am I going to do? And I got into med school. This is all of a sudden not what I want to do. And but my mother said, you're going back. And I was like, well, of course I'm going back. And I went back, and then I didn't know what I was going to do. I didn't know what I was going to do. And then the next time to do an elective came up. And somebody said, why don't you do child psychiatry?
Okay.
And actually, because the Halloween party was that weekend, and they said, if you do psychiatry, then you'll you won't have to work on Saturday, and you can go to the Halloween party. And I was like, okay. So then I did child psychiatry, and I loved it immediately. Loved how you can use your brain in different ways. It's about how you communicate. It's about how you interact. And that's part of the signs and symptoms of mental illness. And then certainly, if you help somebody with their mental illness, you're helping them, their family, the community, the future. I was hooked right away. And also, it's fun. You know, it's fun to talk to little kids and hear their problems and what their goals were and say, yeah, that's something I could do. I felt excited about treating that.
Before you decided to branch off into psychiatry, I mean, obviously, your path in medical school was the same as everybody else's. So your focus now is on helping people with like mental, emotional difficulties, but your training allows you to help with anything, right? I mean, you might not have a specialty in cardiology, right? And the analogy that I make all the time is people, they'll ask me a question and they'll be like, I'm getting divorced or I'm buying a house. Can you look at a contract? And I'm like, would you go to a cardiologist if you were having brain surgery? No, I wouldn't want that. Well, that's the same thing for me. I mean, I'm like a one-trick pony. I'm really good at these disability cases and not much else. As far as like your knowledge of the full body, your ability to treat something, does that play a significant role in how you're helping people with the psychiatry issues that they're coming to you with?
I think absolutely, because at the end of the day, I'm still a physician, a medical doctor. And so that way of thinking, there was a lot of training in just how to think, like a doctor. And what are the pertinent positives? What are the pertinent negatives? Somebody told me it's just as important to prove a diagnosis as to unprove the other diagnoses that you don't think are going on. And so I think that whole way of thinking and the whole body system. And I think probably every appointment somebody will say something about what's going on with their body, and I have to think of all the medical things that could be going on, either to complicate their mental health symptoms that they're reporting or be the cause of. You have to incorporate all of that, or you miss things and you mistreat people. And also with medications, you have to know the interactions. You have to know how it's how it works, and to just think of the biology of it while also thinking of the environmental impacts. That's why I really love psychiatry. You get to think about the biology, but also the whole person, but also their whole life.
It's really interesting. Yeah. So you're really just focused on wellness of the whole person, as opposed to a thought that I have, and I'm not sure how to develop this in conversation, but it's something that comes up a lot with my clients. So I will have a client who gets really up in arms because they're like, I need the judge to, I've been receiving mental health treatment for 6 years, but I finally just got a new diagnosis. And they're so focused on what the diagnosis is, even though the symptoms and how they're functionally limited behind it are the same. Like, okay, now they're giving you a label for what's wrong, but you always were unable to get out of bed consistently. You always were struggling to get motivated to do, take a shower, perform like household chores or activities. So in a social security world, not much has changed in terms of that case. As long as they're seeing a physician, they have a diagnosis for their problems, but they get so upset, the judge didn't consider my bipolar disorder. Well, you've got 17 different diagnoses in the record, but we do have a good reporting of what's going on. But in the medical setting, does it make a huge difference to you how you're helping somebody, whether or not? I guess my question is ultimately, and I'm sorry I'm struggling to get to this.
It's a good question.
Are you focused on treating the symptoms or treating the diagnosis?
Right, because a diagnosis does matter in some situations.
Tell me about that.
Because it matters on paper. It matters to your clients too. It matters for some resources, right? Whether it's school accommodations, insurance, the medications that are covered. It does matter on paper. Does it matter to people to have an identity with a diagnosis? Sometimes, yes. Sometimes it's a positive, sometimes it's a negative. So when I talk to my patients about things, I try to incorporate that. Like, what matters about it being on paper, what matters about, your association with that diagnosis on paper, but at the end of the day, does it matter in your day-to-day life? Does it matter in your functioning? And sometimes those are different answers. So I feel like you can't say one's more important than the other because they matter in different capacities.
Right.
And then they'll change the textbooks, and then it'll all change, and then sometimes people kind of have like an identity question about it. Or people will say, no, my family member did have this diagnosis, but historically that meant something different.
It's interesting because, it was a few years ago now when they just rewrote the DSM, right?
Mm-hmm.
Did that change things for you in your office a lot, and how you treat people and how you approach?
I wouldn't say a lot, but it did. Like what does an autism diagnosis mean?
Right.
And I'm doing like this, like it's the spectrum.
Right.
There were some new diagnoses that might have been a positive, because then they can do research targeting that too. So even like, what does the diagnosis matter? Like for research, you have to know what you're even treating.
Yeah.
Yeah.
Yeah. What's it been like for you starting your own practice? I mean, you told me about how when you were a little girl, you kind of had this dream, and now, we don't ask people how old they are on the show, but I assume you're not a little girl anymore. So now you're kind of like going back to this idea that you had. What's it been like for you opening a medical office? Well,
it's kind of interesting because it kind of feels the same. I'm doing the same work, and it's
just
still
a lot more of it.
Yeah, but then also like I get to meet different people. I love my patients. I love that the honor that they give me, and so I get to meet new people who I hope I can help too. That part I really like, but it's good too because it kind of gives me like freedom here. Like, oh, I can come do a podcast, or I can work on other things. And
I want to talk about one of those other things.
Yeah, okay.
You're spending time on.
Yeah.
Because got your official flyer, same person, Stephanie Abramowitz.
Yeah.
You're running for school board.
I am.
In Solon, Ohio.
Yeah.
Where we both happen to live, right?
Yeah, that's right.
So, obviously, your interests are balanced.
Okay.
As a business owner, a physician, that's obviously got to be a passion of yours. But serving your community is a huge interest of yours as well. Have you been like really active in the schools over the years? I
think so because my children go to school there.
How old are your kids?
My oldest is 10 and my youngest is 3.
Okay.
So out of my 4 children, I have 3 in elementary school and then 1 in preschool. So I tell people I need the schools to be great and wonderful for at least, God willing, 15 years. Because that's when my youngest, is scheduled to graduate. And I went to public school. I work a lot with public schools for my patients, or private schools, and the funding, the teachers' passion, the teachers' union, all that is so intertwined with just this one idea of public education or educating our children and even our community and how that helps. So I could talk forever about it, but they're so intertwined too.
That's what we're here for.
So then when I was working with some advocacy work, mental health advocacy, and some of it was political advocacy, I was seeing that, there is a way that just regular people like me could run for office and also take that perspective. It may be a perspective that I take for granted. What I do, 8 hours a day could also be an avenue to help other people in a different way.
So when did you decide that you were going to run for a school board?
I think I was thinking about running for office early spring. And then school board seemed to be like a natural fit. Have a parent of current students on the board, have a child psychiatrist, and have somebody with familiarity with school accommodations and who talks to children all day about their mental health, about their schoolwork on a board when they're making these decisions about school safety and how to, what priorities are we going to have in our school system.
Are there any other physicians that are on the school board or running?
In my race?
Yeah.
No.
So this is really kind of like a unique vantage point that you would bring to the Solon School Board.
Yeah, I think what I'm hearing is it's you need to have a physician run for office. There's some. Run for school board office. And that person's also a mental health clinician and a child psychiatrist. people get really excited about that part.
What's it been like campaigning for you? Like, what do you do? Where do you like? How do you try and accumulate votes? You knocking on people's doors?
Knocking on a lot of doors.
Wow.
And that part's kind of fun. Like it kind of, I like meeting people. I like talking to them. The weather's good. You know, it's just something to kind of do. So I'll go to the clinic all day, and then I get in the car, and sometimes I go alone, or sometimes I bring some of my kids, and we go and we knock on doors. And I like meeting people, because these people are literally my neighbors, and I wouldn't run across them.
Yeah.
Other way, I like showing my children, especially my daughters, like this is how you knock on someone's door. You need to respect their space, and this is part of the political process. You know, which is important, I think, to show children and to show other residents that like you could run for office. You don't have to wait to retire. You don't have to wait for the right time, because there's never a right time. You just feel a need in your community. You feel a need to help, and just do it.
I love that you're getting your kids involved with this. So are they like really gung-ho about it? And do they get excited?
They
when you
do.
say, we're going to go?
Yeah, they want to ring the doorbells.
What do you call it? What do you call it when you go door to door ringing doorbells?
Oh, canvassing?
Canvassing.
Yeah.
When you guys go canvassing.
Yeah. They like it. They like to ring the doorbells, and there's some really cool doorbells now.
Oh yeah.
So they
the rings.
Yeah, and then
rings.
We get the dogs going. Everybody's flowers are nice. Like one of my daughters wants to smell every single flower, every single house.
Which of your children is most excited about it?
Oh, I think they like different parts.
Okay.
You know, like I think my
for the canvassing part.
Yeah, I think my 3-year-old likes when I say just have some sidewalk chalk and like have a ball. I think my 5-year-old likes the ringing doorbells. My 7-year-old likes to say part of the spiel, part of the speech. I think my 10-year-old likes that we're just out. Maybe he'll see some of his friends. You know, so there's like different parts, but it's a lot. I mean, because it's 1 to 3 hours every day.
Wow.
And then we'll have to stop sometimes because I'll have to go coach soccer, or I'll have to stop because I'll have to take him to another activity, and take a break from canvassing to go, coach a soccer practice, and then come back to it and do another street.
So, I think you gave us kind of your canvassing.
Yeah.
But tell me what your 7-year-old says. What's your 7-year-old's name?
Oh, Vivian.
Okay, so Vivian goes, knocks on the door. She's standing next to you.
Yeah, she says, you should vote for my mom. Obviously, she's the
Why?
mom.
Why should I vote for your mom?
And then they go, and she goes, and she's a feelings doctor and the same lady.
Oh.
Yeah, so, and then people will ask them questions too, like, oh, do you endorse your mom? And they're like, I think so. And then they're like, I don't know what endorsement means. So it's that kind of stuff. Or people are just happy to see, like a young kid, and they just want to, ask them what grade they're in, and what do you think about your mom running for office and such.
I love that.
Yeah, it's a good experience, because I never thought I'd run for office, but like it's nice to spend time with them in that way and show them kind of another part of the world, because they might just
mean like the south side of Solon?
like the political side, like I don't just sit behind a computer, that there's other ways you can help people.
Yeah. Besides
your job.
So when you made the decision to run, was it like a family decision where you sat down and you're like, well, mommy's going to be knocking on a lot of people's doors? But
I did, and I had to kind of explain, like, this is why I'm going to wear a shirt with my name on it. That was a conversation, because my 3-year-old was like, why would you just wear a Stephanie shirt? Like, and I had to kind of explain, like, so that people know and they know me. I think I also had a conversation with my kids, like, is this going to change, if and when I win, is this going to change, like, your life about school or anything like that? And so we had a conversation that, there's going to be people who are going to recognize me. There might be people who might be upset with me, that kind of stuff. I mean, I also had to, like, think a lot, too, because I really wanted to respect that role. That, like, okay, I would be a mother of children in the school, and I could also be a Board of Education member. And what would that mean for, just if we go to the football game? What does that mean when I go to a parent-teacher conference? What does that mean when I want to volunteer at PTA? What does that mean when my children might want to try out for a school event?
Right.
And then what does that mean for my patients, too, to kind of take a public life? Because in psychiatry, there's this thing called the frame about being kind of private and respecting that space, and people not... psychiatrists are known for being private, but there's a reason for it. It's so that whatever's reflected in therapy isn't biased by what they know about them. And so, so the short of it is, like, then people might know that I have this other life that I'd be a board member. But I thought about that too when I was getting more involved with some political work too, that they're going to see Dr. Pope quoted in places, and then they're going to see this other last name too. And then, is that the same person? Are they twins? Like that kind of role. But I think most people understand that, like, some people go by two last names.
Yeah.
And that, especially doctors. So I just explained, I go by my first last name, Pope, professionally, but Abramowitz is my current last name, and so that's what people know me as.
So today's October 11th. The election is what day?
November 7th, but people
7th.
are voting early, and they started voting early yesterday.
Okay, so
Yeah.
what's the next month of your life going to be like? It's a lot more door knocking?
A lot of door knocking, handing out literature, meeting people, whether that's, like at events, and just being out there a lot. And so in meeting people in every way possible. So
do you have to do like fundraisers and stuff like that, or are you allowed to self-fund a campaign?
I think people can do both.
You can do both.
People can do both. So that's another thing too, is like, I have to learn a lot about election campaigns and all those rules too. And so that's also kind of fun for me to learn about another kind of system too, that like I didn't really ever think about. But you have to read the rules, you have to follow the rules, and see how important a board of elections is to just have all this work and work well.
And I mean, especially as a Solon resident, I know, there's a lot of pride in how the Solon schools are supposed to be the best in the state. Most people that I know moved to Solon specifically because they wanted their kids to be in the school district. So there's like a certain responsibility that you must feel to like serve the community in that capacity.
I didn't grow up in Solon. I grew up in another part of Ohio.
Where are you from?
My hometown's called Upper Arlington, and it's a suburb
By
outside
Columbus.
Yeah, you know it. Yeah.
Sure.
So that's where I grew up, and so I would hear about Solon even when I was in high school.
Are you an Ohio State fan from Columbus area?
Yeah.
You know that I went to Michigan. Cut the tape.
I did hear that, and it's so funny that you bring that up, because like when I was growing up, there would be like Ohio State days.
Yeah.
And so it was so almost like in the water that you would go there. And most people's parents, including my own, they had parents who worked for the university as professors or another staff. And so it was so ingrained. And I did go there for undergrad. And now living in Cleveland, I meet people who have shirts from other Big Ten schools.
Oh, yeah.
And I am kind of like, they're wearing that, but there are people who went to other schools besides Ohio State, and they have lives, and they can wear their shirts going grocery shopping, but it still kind of shocks me every time, especially the shirt that you probably wear.
Yeah, well, it's so funny, because on like the little cul-de-sac that I live on, and I've been a Michigan fan since I was a fan of anything, because I'm from Detroit, and just go there, but I'm not like the crazy person that's like hanging flags out and stuff like that. But on my little cul-de-sac, there's like 4 other houses that all have Michigan flags, and everybody in these houses. And I'm like, how did I magically get dropped on some street in Solon, Ohio, where everybody else is a Michigan, went to Michigan, or the kids go to Michigan like I did. It's kind of a cool little community.
People definitely have like an identity. And I think I did when I was younger, about like football and everything. And I think maybe being away from Columbus, or maybe just being older, like there's other parts of my life. But people get excited about it, and that's great and good. I know I have a preference, but it turns. I look back on it and I'm like, why was there such like a contentious feeling? Like we were all humans, and we were probably more alike than.
Wow.
But like there didn't need to be like that like level of fighting, or it's certainly not violence, because then what do you know? 21 years later, you'll end up sitting across from them, and it's gonna be okay.
That's right.
It's gonna be okay.
Well, I'm so glad that you gave us some of your valuable time, especially during campaign season, and as you're getting, this new practice of yours off the ground. I'm glad it's going well. We conclude each of our shows the way that you and I started before the tape started rolling, by enjoying these delicious, delectable donuts that we picked. You chose the flavor. What are we looking at here?
I just like a good plain donut with chocolate on top.
Chocolate on
Yeah,
top?
that was like the treat when I was little.
Okay, well, we're at the Mad Batter Bakehouse here I think we're in Bainbridge, Chagrin Falls, right on the border.
Yeah.
And I happen to know that these donuts are delicious because this donut shop is not terribly far from either of our homes.
Yep.
But I want to take a bite with you. Ooh, this has a nice thick texture
Yeah,
to
we
it.
get a cheers?
We'll do a little cheers.
Good.
Let's see. Are you going to bring your kids back here?
Yeah, this is better than what I remember them being when I was a child.
Delicious. Has it been that long since you had a donut?
Oh, it might have been.
No way. You really?
Well, maybe when I was pregnant I had some donuts.
That's quite the craving. That would work well for this podcast. Well, thank you so much again. I'm so glad that we got a chance to chat. And best of luck to you next
Thank
month.
you very much. Yeah.
Thank you.
Thanks for listening to the Triple D Podcast, Donuts, Disability, and Discourse. Rate, subscribe, and tune in next week for more discourse and donuts.